Welcome to the YWCA Hartford Region Community Matters conversation, where we embark on diving into the conversations that matter most to you. Today, we will be talking about the COVID-19 vaccinations and the many ways that this matters to you. To the women in our community that continue to wake up every morning and be the first responders to our community's needs. To the women in our community that continue to hold down the structures of our families to make sure that our society can move forward. To the women in our community that show up in every space fathomable. This conversation is dedicated to you. Many of us, when considering the COVID-19 vaccinations, have so many questions about how this vaccine works, how it can and will work in our bodies, and more importantly, how this is an important measure in protecting our community. So to start us off in our conversation, we want to take a look at exactly how the vaccine works. And this little video that we'll show you next will share some of that information.
How does a COVID-19 mRNA vaccine work? COVID vaccines are now available. Some of the COVID-19 vaccines are mRNA vaccines. But what does this mean? mRNA vaccines are different from traditional vaccines. mRNA vaccines don't expose you to any real virus. Instead, they're made with messenger ribonucleic acid, or mRNA. This is a type of molecule that gives instructions to the cell for how to make different kinds of proteins. mRNA molecules are a natural part of our cells and how our bodies work. Researchers have been working with mRNA vaccines for many years. They are made more easily and safely in a lab than a vaccine that uses a virus. Because of this, they can also be made faster. The COVID-19 mRNA vaccines have passed many tests in labs and in thousands of people and meet strict standards from the FDA. So, how do these vaccines work? First, a COVID-19 mRNA vaccine is injected into a muscle in your upper arm. Some muscle cells take the mRNA instruction from the vaccine and make a harmless piece of a protein called a spike protein. This protein is found on the outside of the SARS-CoV-2 virus that causes COVID-19. The muscle cells then destroy the instructions for how to make the spike protein. The mRNA never goes into the nucleus of your cells, where your DNA is stored. The newly made spike protein now sits on the surface of the muscle cells. Your immune system senses the spike protein as a foreign threat to destroy. It starts making antibodies to fight anything with that spike protein on it. This will help your body's immune system recognize and fight the real virus if it ever shows up. It's kind of like recognizing someone by the hat they wear. Your body is then prepared to spot COVID-19 and fight it off before it grows in your body's cells. Fast facts to remember about COVID-19 mRNA vaccines. They help get your body ready to fight off the COVID-19 virus before it makes you sick. They don't use any live, dead, or weak virus. They can't give you COVID-19. They don't affect your DNA. Want to learn more? Go to cdc.gov to find more information about mRNA vaccines. You can also learn more about how the vaccines were approved at fda.gov.
Now, wasn't that informative? Gave you all the little drawings to explain how things move around in your body. But that doesn't mean we've answered all the questions just because we know how it works. So to answer some of these questions with more elaboration, we've pulled in the professionals of our local areas, voices that we trust, the doctors that work at our local hospitals, the individuals that, when it comes to infectious disease, these are our local experts. Joining us is Dr. Jessica Abrantes, MD. She is the Chief Infectious Disease Officer at St. Francis Hospital. and we are glad to have her with us. Jessica, how are you?
Hi, thanks for having us.
Glad to have you. We also have with us Dr. David Bannock, who is the head of infectious prevention at UConn Health. Dr. Bannock, how are you?
I'm doing well. Thanks for having me on.
Awesome. Glad to have you. And last but certainly not least, we have with us Dr. Sunil Dukkana he is the Chief Medical Officer of Charter Oak Health Center. Dr. Dukkana, how are you? Sir, you are still muted. And if you're having trouble unmuting,
Sorry. No, I'm sorry. I said more vaccines and more arms makes me happy, so I'm good.
Okay, awesome. Well, we are glad to have all of you with us to participate in this important conversation. And I must say, at the forefront, even selfishly, I'm excited to have this conversation. Being a woman in the community, being a mother of two, and recognizing that this is an important time. We all went through the traumas of 2020, and coming into 2021, we expect something greater out of this year, and it looks like it's starting off with vaccinations. So, Dr. Abrantes, you also serve on the governor's COVID-19 vaccine advisory group. And there's some information out there that's been promoted by the CDC that says 2 out of every 3 caregivers in the United States are women, meaning they provide daily or regular support to children, adults, or people with chronic illnesses and disabilities. Women who are caregivers have a risk for poor physical and mental health, including depression and anxiety. With all of that in consideration, what do the current transmission rates tell us about how COVID-19 is impacting women?
So I think you kind of already stated somewhat of it, how you mentioned that 2020 for a lot of people, women included, was very traumatic. Obviously, this has been devastating for, all of the U.S. It's impacted not just healthcare workers, but really everyone in the community. With regards to women, you mentioned it, how a lot of times we are the primary caregivers, whether single mom or having a spouse at home too, or help. And it's not just with children, but with parents, potentially siblings. In certain communities, it's very common to have multiple generations within a household as well. So clearly that's impacted them significantly. We've seen so many jobs lost, school shut down back in March in many areas. And, it left women especially, in a critical time of, how do they take care still of the family and still function with a lot of other things. In my respect, I had, from a personal basis, I had to continue working, but it was still an extraordinary struggle to figure out, who's going to watch my kids. I have 2 children at home.
Yeah.
And also, how are we going to deal with remote school learning? And meanwhile, women were still getting infected. A lot of times, especially for our elderly population that were at home, it's the women that are taking care of them and then placing them at risk as well. You mentioned it too, how a lot of times, as women, we may neglect our health and put others first. And again, still that means then, hospitalizations for them, they may be the type also, to come to the hospital later, as a lot of people were. So again, it had a huge impact on women, the workforce, childcare, parent care. And again, like I mentioned, a lot of homes have multi-generations in the household. So again, huge impact that, can't always go by numbers, but clearly we've seen it be devastating across the state.
Yeah. There are some other numbers that I wanted to bring into consideration here. When it comes to cardiovascular disease is the number one killer for nearly 500 or 50, actually 50,000 African American women annually. And of African American women ages 20 and older, 49% have heart disease. Now, I bring up these statistics because COVID-19 has been linked to having lingering heart issues for people. My mother actually, I can bring this transparency to the space and say that my mother, as a frontline worker, she works in the hospitals, contracted COVID, and she, to this day, has heart issues that they're hoping will just come to resolution on their own. So with women that are having these pre-existing conditions, Dr. Bannock, perhaps you can speak to this as well. What is it that we can do or to look out for, to know, or and to gauge the risk that women have when it comes to heart disease?
Sure. So, I mean, I think these are really important questions. With COVID-19, we are still learning quite a bit, including the impact of the COVID-19 infection, and that may linger. We've seen individuals who have developed consequences in their lungs and their heart disease afterwards. So, I think a few things that we can learn. First, when it comes to COVID, prevention is going to be critical. And I think anyone who has any pre-existing conditions that will put them at risk for severe infections, including pre-existing heart disease, really needs to be vaccinated. I think that's a really critical piece, and also focusing on all those other prevention strategies that we've been kind of consistently emphasizing over the last year. So prevention is going to be most important, but also of equal importance is if someone does develop COVID-19, to really get evaluated, get checked out, and not just as a one-time event. Okay, I'm recovered, but really think about the follow-up that's needed. Some of these symptoms and changes that we see after a COVID infection can linger for months, and I think really important that individuals are linked in with healthcare, that they have close follow-up if they do have a COVID infection with their healthcare providers, and really just emphasizing that this may not just be an isolated event. There may be things to look at over the longer term period after the infection resolves.
Mm-hmm. Okay, so there's just so much to still learn about how this infection is actually affecting people in their bodies. Well, there's some good news at least that the video gave us, and I want to ask Dr. DeCunna if you can confirm what the video presented to us, that when it comes to the vaccination, there's a lot of fear out there that what's happening is they're taking the actual virus, some mutation of it, and injecting you with that to see if your body can build up an immunity. And the video said that's not true, that there's a whole nother mechanism in place for that. Dr. DeCunna, can you speak to exactly what side effects people might be concerned about or can look out for with the actual vaccine?
Sure. First, let me say I'm sorry that your mother contracted COVID. I mean, if all of us were better prepared for a pandemic, maybe we would have never had that. So, but I'm also glad that she was one of those who at least made it out of the thing, and having lost so many people, that at least for this grace we should be thankful. So, to answer your question about what exactly should we worry about the vaccine, the simplest thing to say is that every child who goes to school in the United States has to take vaccines today. Some form of vaccine. It is a protection against a larger dysfunction or a larger problem that we can prevent. So if you take vaccine in this case, the most common effect would be actually the pain that you'd have, right? A little bit of pain is better than having a lot of grief later. So that's one thing. So pain in the local area is definitely a thing that you would see. But the most important thing is that because it does not contain the virus, this is not something to be afraid of, because the pain and the local reaction you get is actually that your body is performing the function correctly, that it is responding to what you have in this virus. So that tells us one thing, is that your body is preparing itself. Certainly, there are different people are developing different amount of immunity, and at the present time, most people require a second injection. Yes, the fear is that previously we've had people who are not able to take vaccines. What should they do? Previously, people have had vaccines that have affected them or they've known of people who had bad reactions. And certainly the press talking about having a reaction where you can collapse suddenly, and then having social media and others will talk more about those than the 90, 99, 98% of people who actually do really well. That and so the and after the second dose, as the New England Journal just yesterday said, is that actually you can see a diminishment of the transmission of the virus to somebody else. So not only is it good on one side from the point of view that you are protecting yourself, you may be protecting the one that you love.
Mm-hmm.
That's the real benefit to us. So that's why I would say, for a little pain, there's a lot of gain. The second thing to worry about is fatigue. I'm definitely fatigued, and some people are there. The third thing is about some people feel like they've been for sometimes on the first dose, sometimes the second dose, it may feel different than they normally feel. But be assured that by the next morning, or maybe the second morning, most of us feel great and are just happy to have known this. The one thing caveat I say is that if you have a conversation with your physician to ease your doubt, go to the person you trust. That's what I would say is, and at a federally qualified health center, the community, we are within the community. The people we serve are the people who are our board, which means that they make up our board, which means that we are going to do exactly what they feel our community does. So there's where I would say is the trust in the people they see is what will benefit us.
And that concept of trust is important, especially when dealing with vulnerable communities. And right now, I just want to take the moment to say that we are here with our professionals. And if you have any additional questions, we encourage you all to enter them into the comment section, and we will share them with the professionals that we have here. We are excited to continue in our conversation with Dr. Ducana of the Charter Oak Health Center. As you're talking about community, Dr. Ducana, the CDC says that the goal of community mitigation in areas with local COVID-19 transmissions is to slow its spread and to protect all individuals. And that's some of what you spoke to. But are there any negative sides to this process? What are some of the potential negative impacts of the vaccination strategy that we have in play here in Connecticut?
I'm glad you asked that question. It's a really important question. And I will take it from the point of view of, I'll call it the first 100. So last May, in our health center, we did the first 100 tests. And on the first 100 tests when we did, 80 of those tests were positives. 80 of the first positives of the first 100 positives happened to be in communities like minorities, immigrants, people who live in crowded public housing, and as well as people who worked a job or multiple jobs for a living. Now I'll fast forward to January 2021 to my first 100 vaccine. Of the first 100 people who got vaccine, 80% of those people happen to be not of the same group that had COVID. That's the stark reality. So whether it was intentional or not, I'll ask the question to myself and to all of us: who gets the vaccine would have been answered. Did the people who get the vaccine, were they the ones who society defined as being the one who needed it most, or was it the ones that truly needed it the most? Mm-hmm. So working in the FQHC has taught me that it is the one in the most need, and therefore that's what we should have done different.
Mm-hmm.
If you take that and ask me again, what is the true definition of health, and what does social health mean? Maybe when I was young, I would have said it's about asking about alcohol, drugs, and tobacco. But today, it's about asking about vulnerability. It's about housing. It's about poverty. It's about what supplies do I have? Can I make it to the doctor? Do I have the right person? So it's that. So those are the changes. And I guess if that's something that would be looked at, I would probably say. But again, today is today. We can definitely get better.
Right. And to that effect, in our pre-conversation, Dr. Abrantes was sharing some expansion that was going on with testing sites. So I do want to take a pause for you all to be able to share where there's some expansion in your testing sites as well as your vaccination sites as an opportunity for community members to take advantage of that, considering that the governor has altered the rollout plan and changed some of the distribution based on age. Dr. Abrantes, starting with you, if you can share some of those sites that are available for vaccination, that would be wonderful.
Sure, absolutely. So here at St. Francis, we do have a vaccination center. It's in what we call our SIPSI Center, right on Ashley Street here in Hartford. And then recently we opened up additional spots in the Parker Memorial Community Center, and then also the South End Senior Center too. We also have sites at St. Mary's Hospital, as well as a local school. I apologize, it's slipping my mind, associated with near St. Mary's, so that we can have kind of the Waterbury area as well. And again, our main goal was to try and spread out, especially to vulnerable communities too, and make sure we had enough sites so that people can actually have access to the vaccines. A lot of times what's happening now, it's not that we don't have the space to give the vaccines, it's because we're using up our vaccines like most hospitals are each week. It's just waiting for the allocation that we get each week from the state.
Thank you for that. Dr. DeCunna, I know that the Charter Oak Center itself, properly here on Albany Avenue, is also a site. And my mother-in-law and my husband, who serves as a frontline worker, did get their first distribution of the vaccine actually at the Yard Goat Stadium. So I am aware of those sites. Are there any additional sites with Charter Oak?
Yes, so we actually last week did in Bloomfield as well. But Bloomfield, we did it uniquely where we said you can come for a test and you can come for a vaccine. So we had both where you could get both of them. And one of the unique things about Charter Oak is that we've been around the city doing testing and a partnership we developed with Trinity. And so Dr. Abrantes is very familiar with our partnership with Trinity and ours. We're both of us together in the city of Hartford and around the city of Hartford. And in fact, as far as Colchester, have done well over 40,000 tests together. So we've gone around the community here to be sure that the people around, in and around Hartford have access to testing. What we were shocked to see was the number of positives. And even as late as this week, while the general state positivity rate is very low, our positive rate remains between 6 to 10%. Mm-hmm. So that tells us that there's still a need to continue that quest to be able to get all the people back in. But at the same time, the wonderful nature of saying that we can also prevent, and with the expansion, we hope to get enough of people to have opportunity. While we do, the downside to this is that people who started to get the vaccine may have got it because they were able to get it into the system easier, or they had access to technology. Going back to my previous thing of how equitable is equity, but then when they can drive up, we register them there, we help them there, and we explain it there. So because there's a provider in that or a nurse within the tent while they're filling out the form, so they don't have to worry, and then we register them. So those are the ways that we work around to ensure that our community, and especially the communities of those who don't speak the language, is best served.
Mm-hmm. Thank you for explaining how equity plays a role in rolling out vaccination. Dr. Banak, I want to also give you the opportunity to share how UConn Health is approaching vaccinations and where your process is and what sites you have available.
Sure. So thanks. Our UConn Health specific sites, we have two sites here in Farmington, one at our main campus site in our outpatient pavilion, and another site at Munson Rowan, which is a few miles away from here. And our third site is official site is up in the Stores area where we have our UConn campus. So those are the three main UConn specific sites. We are working to support some of the other sites as well throughout the region. I will also mention that our UConn Health campus is accessible by public transportation, multiple different routes from the Hartford area as well. We're constantly looking at expanding, as Dr. Abrantes mentioned. Our supply, we have much more demand than supply, and we're ready to administer more vaccines as long as we get more supply from the state and from the federal government. I think Connecticut residents are so eager to be vaccinated, which is terrific. I think the more vaccines that we can get access to, the better.
Well, Dr. Bennett, while we're talking about supply, let's talk about the differences between these vaccines. So most of us have heard about the Moderna and the Pfizer vaccinations, and now there's a third entering the party with Johnson & Johnson. And there is some debate around the effectiveness of each, or the reason why one is being preferred over the other. Can you share with us about some of the differences between the vaccines?
Sure. That's a great question. We can talk about that in some details. So I think the video that was played at the beginning of this presentation really nicely described how the mRNA vaccines work. Just to kind of summarize, the vaccines contain a little bit of that mRNA, that genetic code that comes into the cells and allows the body's natural machinery to make that spike protein that helps make the immune response that's required to protect from any future infections. Really important technology. I think a few key points that I'll emphasize is that there's no live virus as part of that vaccine, and the vaccine doesn't, the mRNA doesn't go into the nucleus of the cell, which is where everyone's DNA is. So it can't impact or influence the DNA of an individual at all, because it doesn't even get into that part of the cell. So the newer vaccine that's coming, I should say, soon to be authorized vaccine that's going to be undergoing FDA approval tomorrow and into the weekend, FDA authorization, is the vaccine by Johnson & Johnson, which in principle uses the same type of approach. So it involves bringing in a little bit of genetic code, but rather than actually the vaccine actually containing the genetic code, it's sort of pitched onto a vector, which is what kind of transports that genetic material into the cell. And that's a viral vector called adenovirus. Now, important to know that the only role of that virus is to literally transport that bit of genetic code into the cell. It's not a live virus. It can't replicate and cause people to be sick with either COVID-19 or adenovirus infection. It just is basically used to kind of bring that genetic material into the cell, and then through an individual's own protein making ability, helps make that spike protein, which, just like the mRNA vaccines, helps stimulate the immune response to provide that protection. So very similar, but it just uses that virus to bring the material into the cell. And I think the real benefit to that is that it's much more stable. So you may have heard that these mRNA vaccines require very special cold temperatures to store and to transport. But when we package it with that adenovirus vector, that's not required. It can actually be much more stable at room temperature. It doesn't have as strict requirements as far as storage and transportation. And that's really important and really going to help us get more vaccine out there. So that's the ways that the vaccines kind of work. In terms of the efficacy data, I think what we're seeing was just sort of released to the FDA yesterday, was the data that showed how effective these vaccines are, and it's remarkable. In terms of preventing all symptomatic infections, the efficacy rate was a little above 70%. But in terms of preventing severe infections requiring hospitalization and severe illness, like requiring to be on a ventilator, essentially 100%. So I think that is so assuring that these vaccines are really performing well. And I'll say the other important part of the J&J vaccine is that it's a single dose vaccine, which is a real game changer. I think one of the big factors that limits us with the 2-dose vaccines is that we have to get that second dose in to ensure that we get an adequate immune response. But with a single dose vaccine, that really changes everything. So we're really excited about rolling this out. I anticipate it'll become available within the next week to Connecticut residents, and I think there's a lot of enthusiasm. I'm personally very excited because I know it's going to help us vaccinate as many people as we can, which is really the goal of all of us.
Mm-hmm. And you expressed that struggle with with the Pfizer and Moderna vaccine needing both doses. What would you say to the person that's like, I got one and I didn't really like it, so I don't feel like going back for the other one? I must be covered though. I got one.
So the answer is you probably do get some protection from the first one, but if you really want to get the maximum amount of protection, both in terms of the amount of antibody that you have to protect you, and also those T cells that are so important. That second dose really boosts it up to give you adequate protection. And then, the other piece is that second dose with these mRNA vaccines provides you a longer duration of protection. So, while after a one dose, you may get some protection, you likely do. I think the amount of protection and the duration of that protection is not going to be as much as you get with that booster second dose. So really, at this point, from all the data that we're seeing, that second dose is critical. So I would, even if you do get some symptoms after the first dose, go ahead and get that second dose. I guess the one exception would be for individuals who have a severe allergic reaction after the first dose. Those are the ones that we have to, pause before giving that second dose and really look at whether there's going to be any risk. But for people that do get some of that fatigue, some of that achiness after the first dose, I think still so important to get that second dose to really maximize the amount of immunity that someone's going to get from the vaccine.
Right. And I've been hearing from many that have gotten that second dose that the second dose is the doozy. That's the one that gets you. Why is it that there seems to be more symptoms associated with the second dose than the first?
So I think that has to do with the way that these vaccines actually affect the immune system and cause that great immune response. So, the first dose really kind of primes the immune system. It starts, generating those antibodies, those T cells, but it's that second dose that really boosts them up. And that's a really good thing in terms of protection because you're going to get a really high level of antibody and T cells to protect you. But there's some symptoms associated with that. So, as your body revs up its immune system to provide that protection, that causes a bit of fatigue, and that's going to cause some of the achiness and the soreness, maybe even a little low-grade fever. But that's part of your body making that response that you want in terms of providing protection. So, I think it's a trade-off. You do get those symptoms a little bit more after that second dose, but that's your body telling you this is working, this is making those antibodies, and this is going to provide that protection.
Wonderful. For those of you that are just joining our conversation, as we dive in deeply to the COVID-19 vaccinations and how they are affecting women in particular and women of color, I encourage you to write in the chat any questions that are on your mind or share any testimonies that you have within your families from vaccination experiences. Dr. Abarantes, I want to ask you a question. Now, COVID-19 has slowed down a lot of things in our country. It has slowed the economy, it has slowed education, but it has not slowed baby production. During the pandemic, I have seen more beautiful babies born than I think I've taken notice of in previous years. And with that being said, has any variation of the vaccine been tested on pregnant women? And if so, what are the findings for maternal and fetal outcomes?
Sure. So I'm going to speak on both a physician level and a personal level as well. So unfortunately, pregnant women were excluded from the trials, which is very typical. Again, pregnancy is a special population. Just like children, they usually get excluded from trials. That being said, both the American College of Obstetrics and Gynecology, as well as Society of Maternal Fetal Medicine, actually advocated that Pfizer and Moderna allow pregnant women to be included, I should say, in these trials. So that being said, you kind of mentioned it. So life does happen, and there were pregnant, or I should say, women who entered these trials and then did become pregnant. The numbers were very small, probably a little bit over 20, but they continued to follow these women as well during the trials. The other thing is that a lot of studies get done in animals. So we have now the developmental and reproductive toxicity studies that were done in animals with both Pfizer and Moderna, and none have thus far shown any abnormal signals, or I should say red flag signals, both for fertility reasons as well as any complications for both mom and fetus or baby. The other thing is, so again, we don't have the data, but based on what, a lot of we know about vaccines, and Dr. Bannock and Dr. Jacuna mentioned as well, that these are not live vaccines. So there are very few vaccines that are contraindicated in pregnancy. That being said, it's really just live vaccines. Each pregnancy, women are encouraged to get their flu shot as well as their tetanus pertussis shot as well to give that immunity to baby, because babies usually can't get vaccinated for certain things, flu, for example, until they're 6 months of age. So that being said, the CDC has come out with recommendations, as well as American College of Obstetrics and the Society of Maternal Fetal Medicine, advocating that women be allowed to choose getting vaccinated, especially if they fit into that high criteria, or I guess you can say if they're in line to get the vaccine. The other thing is, what do we know about COVID-19 infection and pregnancy? And we know that they can have severe disease, they can be hospitalized, they can, have maternal death. It's also been associated with preterm birth as well. A lot of that, then you have to weigh the risks and benefits between that and then getting back the vaccine. On a personal level, I'm 7 months pregnant, and I did have to make that decision. And again, I counsel all my patients that having that conversation with your OBGYN and knowing your risk of getting the infection versus what the risks are for the vaccine. So for me, it was relatively easy, although it did make me pause and try to look at the data that's out there about, should I get the vaccine versus wait and not get the vaccine, but continue to see patients who have COVID and obviously be at risk for infection too. The other thing is that Pfizer recently just announced that they actually will be doing a trial on pregnant women. I think about 4,000 women that they want to enroll to actually look between placebo, meaning no vaccine, versus getting the active vaccine. Also, with all of the surveillance that's being done with the vaccines, for example, VSafe, which is kind of a smartphone app based that when you get the vaccine, you kind of apply and then you get weekly updates from to see how you're doing, I guess you can say. And as of the last week of January, over 15,000 women have actually reported that they were pregnant and received the vaccine as well. So a lot of data that's ongoing as well to make sure there's no red flags or abnormal signals to say that it would be, harmful for pregnant women to get the vaccine.
Wow. Well, congratulations first. And thank you for sharing that important information with us. So while there hasn't been formal trials yet, they are on the verge of doing so. And at the forefront, it seems like there is no outright reason to have concern, but the exploration is merited. Awesome. Thank you. We do have some questions from our viewers. And so I will share this one. Karen Inkle asked the question, if you don't have as severe of a reaction to the second dose as others, is it indicative of your level of protection? Anyone can feel free to bite off of that one.
I'll jump in on that one because speaking from my own experience, I didn't have very much as far as symptoms after both my first and my second dose. So maybe some feeling of disappointment. However, when that happened, I looked in more detail at the data from the clinical trials and saw that in reality, less than half the people actually did have symptoms afterwards. And even the people that didn't have symptoms still had the protection. So that 95% efficacy applied across all the people enrolled in the trial, including about half who had no symptoms. So that provided me some reassurance. So me personally, after I had my first and second doses, I didn't have any symptoms, maybe a little bit of soreness in the arm after the second dose. But I was very reassured by what I saw from the clinical studies that showed that even those who didn't have symptoms still got good protection.
Awesome. Any additional comments on that?
For me, I would say that for my, if you were my mother who never complains, she says she never has symptoms, but I could make out that she did have symptoms. So sometimes also partly because some people say they don't have symptoms or don't have that tolerance is different. So there's also that part of it to keep and pay attention to.
Thank you, Dr. DeCuna. And we have another question from Carol Jimenez, or Jimenez. I apologize for that mispronunciation. And Carol asked the question, for those individuals who have already contracted COVID-19 and have recuperated, will the vaccine provide additional coverage since their own bodies may have already protective antibodies?
So I can start with that one. So yes, we know that folks who develop COVID-19 infection do have some level of immunity, I should say. And usually though, it can wane. And that's the concern that we have, that just because you've been infected, it won't be a long lasting immunity. And we've seen that wane based on the trials that's been done. So it's still recommended that, yes, even if you've been infected, to get the vaccine so that we can make sure that you then have the protection of antibodies. Now, the duration of the vaccine is also still kind of up in the air because obviously we've just started doing the mass vaccinations, but there's ongoing studies too to then see how long will the vaccine actually give us immunity.
Thank you for that, Dr.
I'll probably add as well that you don't know if you could get reinfected with a different strain. And so one of the problems, because we have different strains and more the strains that are more infectious to others, you have to pay attention to that as well. So it's not just about having COVID, but what strain of COVID, because that's to pay attention to that as well. And that's why it's probably an excellent idea to continue to get your vaccine.
That's an excellent point that you bring up, Dr. DeCunna. And in your professional opinions, do we foresee this being an ongoing conversation about vaccination, something that is annual, the same way that the flu virus mutates and annually we get a flu vaccination? Can we expect the same thing of COVID-19?
So yes, but what you want to know is that I think based on what we, if you look at the levels of immunity you get, and the fact that this vaccine induces immunity through a particular cellular mechanism called the T cells. So whenever immunity is induced by T cells, it actually lasts much longer. And we have comparative things with other vaccines that do this well that tend to last longer. On the other hand, the flu virus mutates so much every year, or we have different mutations different years. So therefore, it is a different reason for taking that vaccine as well. So there are two ways to look at it. One, from the point of view, is that you need a vaccine if it keeps on mutating. But it seems that the more people get, if you do have enough of what we call the wild virus, like we did, and enough of people immunized, the chances of having different forms of the virus become diminishing. So that's one thing we could say that maybe that will help us with longer duration because there's lesser of an infection burden in the community. On the other hand, we still don't know if the length of immunity, and some are predicting that this will probably be at least 2 to 3 years. So I'm keeping my fingers crossed, and in fact, both hands fingers crossed that it'll say 2 to 3 years rather than my annual flu shot. But I would be willing to take it annually as well.
Okay. Now, Dr. Abrantes, thank you for that, Dr. DeCunna. Dr. Abrantes, you brought up in the conversation, not only has it not been fully tested in pregnant women, but also in children. When we say children, what age bracket are we talking about? And what can we expect for testing moving forward with that vaccination in children?
Sure. So Pfizer actually is emergency use authorization approved for 16 and above. And we have vaccinated, at least from our personal experience too, we've had vaccinated as young as 16, 17. EMTs, for example, fall into the emergency health personnel, et cetera. So, that started, but it is approved. Moderna is not. Both trials, however, are doing ongoing studies in children. Right now, they've, I can't remember which one, but one is completely enrolled with 12 and above, and the other is continuing to enroll 12 and above. So we'll likely have more data within the next coming months. And then it's likely expected that they would go down to 5 years of age and above to start those trials as well. And really, when we're looking at children, it's not really about the number of children because it's a much smaller group. But just to make sure that, they have the right dose in kids, it is still safe, and, nothing else needs to be changed with regards to vaccinating children. And it's likely by most experts expected that potentially late spring, early summer, we may start to be able to vaccinate our children as well.
Okay. That's a lot of important information. And I think, beyond just the idea of vaccinating our children, right now they're vaccinating frontline workers. But overall, Dr. DeCunna, what advice or what facts would you like to share with parents regarding COVID-19 vaccinations and what they need to consider when it comes to their homes, their communities, and their children?
So definitely the first thing is that we don't know if the parent getting the vaccine will actually protect the child. But that may be one reason to be optimistic. The second thing is that the hope is that if your child gets the COVID, the vaccine will protect you. So if you look at it, there's two ways to have this where the parent getting the vaccination helps the family, the child having COVID protects the parent as well. And then on the other side is that because we know that there are trials ongoing and children have taken other vaccines, and the hope is that if children get less sick as well, that they will be able to return to many of the activities, and the other side of the vulnerability is taken care of. But the unfortunate thing is that because we do not have enough of information, it's really impossible to try and predict, other than saying that the important part is to promote the vaccines for all of our adults, and therefore build what we call the herd immunity. And by building herd immunity, we have reduced our chance of the spread of the disease. So that's one of the ways to go about it, to help protect families and therefore children, and vice versa.
Wonderful, thank you. And as we are encouraging our viewers to enter into the comment section your final questions, I want to appeal to our panelists for any final tidbits that you want to share. Is there anything left on your heart that you want to pour out before we conclude our conversation today?
I was going to say, just to go off what Dr. DeCunha was saying too, of how, whether we can vaccinate children and how the importance of vaccinating others around us, similar to other vaccines where we know certain folks cannot get vaccinated, it's very important for those of us that can get vaccinated to do so that we can build that herd immunity too. The other misnomer that I sometimes hear a lot of times is, well, I've been infected, I'll be okay. Now, obviously, severe COVID, hospitalization, and death are significant, and we can clearly see those numbers. But like Dr. Bannock alluded to before, it's very critical to understand that even healthy patients and healthy community members who get very mildly sick can then have these long-lasting symptoms. A lot of us have heard of, the term long haulers, where people can have symptoms for months, and we really don't know the long-lasting effects of the COVID infection. So really, to prevent infection and not ever get infected by getting the vaccine is such an important concept for people to understand, so that we really continue to build herd immunity based on vaccines and that immunity versus people getting infected.
Thank you.
So I'll just add a few comments. Thank you to both the other speakers for their insights. I think when it comes down to it, this vaccine is going to be what we need to turn the corner, not just in terms of preventing illness in individuals, but also, when we think about going back to normalcy, that this vaccine is going to be critical, and that we have all the data to show that on an individual basis, someone who gets vaccinated has an extremely protective effect on reducing their risk for getting sick and hospitalized. But what's come out, and it's even more exciting, is that not only does the vaccine prevent individuals from getting sick, but it also prevents spreading virus to others. And now there's been data that's come from a very recently published study in Israel that shows that the vaccine prevents what we call asymptomatic infection. So it prevents people from getting infected and not having symptoms, and thereby makes them less contagious to other people. Now we're seeing that in the data that's come out from Israel, from the UK, and even now some of the data that just got released from regarding the Johnson & Johnson vaccine shows that it can be preventive, not just against people developing symptoms and illness, but also against asymptomatic infection. So, really important, and just emphasizing how important it is for us to get vaccinated, not just to protect ourselves, but to protect all of those who are around us from becoming infected. So again, I think really strong data that is so encouraging, and really emphasizes how important this vaccine is for all of us.
Thank you, Dr. Bannock. Dr. DeCunha, any final sentiments?
Absolutely. I want people to talk to the people they trust. Trust is earned. So therefore, the ones that you trust, talk to them. They are the best people to help you make the right decision. And in that sense, I'd say, how does equity work? How do we have a fair and just opportunity for everybody to stay healthy? There should be no obstacles. There should be no barriers to obtaining this vaccine. So I implore on one side to have the people who really need it have the ability to get it where they are, and we provide it to them where they can get it in that location. At the same time, be sure that people are not forgotten or not used on or experimented on. So, having said that, I strongly believe that this is the opportunity for us to build equity, to build a common goal of saying that health really means that all of us have the same quality of health throughout this country and throughout this system.
Dr. DeCunna, Dr. Abrantes, and Dr. Bannock, thank you for your time and your expertise and lending your sentiments and your heart to this conversation on today. We encourage you all to stay connected with us here at the YWCA Hartford region. We have a list of resources available on our webpage to share with you. When you see these resources on our webpage, we encourage you to take the time to review them and ask yourselves the additional questions that you might have on your heart. These are some vetted resources of where you can get your answers. These resources come from a combination of the CDC, the Governor's Task Force on COVID-19, and the Charter Oak Medical Center, the Yukon Health Center, and Trinity Health of New England. We hope this information that you find here is a vetted resource that you can rely on, and we encourage you to do what is best for your family and your community. Additionally, at the YWCA Hartford region, we want to encourage you to continue to participate with us as we strive to move forward on our mission to eliminate racism and empower women, promoting peace, justice, and dignity for all. Part of this means that we are endeavoring on statewide campaigns to address racism as a public health crisis. When you see our webpage and you see this material, we encourage you to sign on to take action. When you click on the action sheet, you will see the multiple ways that you can call on our civic leaders here in the state of Connecticut, call on Governor Ned Lamont, call on your legislator, and call on your mayor to take action to address racism as a public health crisis. One of our speakers, Dr. DeCunna, spoke to the point that oftentimes in communities of color, in urban areas, there are multifaceted factors that our community is facing that put us at risk and actually not only reduce the overall well-being of an individual, a community, and a family, but can also reduce the life expectancy of people of color here in our state. So we encourage you to join this movement to address racism as a public health crisis. And lastly, stick with us to learn how to become an ally in spaces of discomfort. Right now, as we are facing dual pandemics, we are looking at COVID-19, and you have heard today the many resources that are available to mitigate this through vaccination, but we are also facing the pandemic of racism. And when confronted with this pandemic, all hands must be on deck to address this. So if you are an individual seeking out how you can be an ally, we encourage you to join us for our Allies Guide to Advocacy webinar on March 5th at 12 p.m. While we continue on our mission here to empower women and to eliminate racism, we know that we can make this change happen together. So we thank you for tuning in today, and we look forward to seeing you next time.